The cutaneous innervation of the terminal branch of the axillary nerve is shown here. The axillary nerve distribution is highlighted here in pink and covers the cutaneous aspect of the shoulder. This block also provides anesthesia over the deltoid muscle. An interscalene brachial plexus nerve block, which we talk about in another lecture, would also cover this distribution, but the axillary block does not carry the same risk of phrenic nerve paralysis. This block is particularly useful for problems involving the skin over the deltoid muscle, like the abscess shown here in this photograph. Abscesses in this area can occur in patients with IV drug use skin popping, or in those who use anabolic steroids. An axillary block in this patient would allow for effective incision and drainage. The axillary nerve block would also be effective for lacerations over this area. The ideal positioning for the patient to perform the axillary nerve block is prone. To identify the anatomy, the probe is placed parallel to the humerus. You can start at the level of the humeral head and slide the probe inferior. If you keep the shaft of the humerus in the long axis, the neurovascular bundle of the axillary nerve should be seen about 3 to 4 centimeters inferior to the acromion. When scanning this region for the axillary nerve, an important landmark is the shaft of the humerus, outlined in white here. It can be tricky to keep the shaft of the humerus in long axis, but this gives you the best chance of identifying the target nerve. The humeral head defines the cranial orientation. You'll see two distinct muscle layers. The deltoid muscle body lies superficial, and the teres minor deep to that. The neurovascular bundle sits within the teres minor. The axillary nerve, which is outlined in yellow here, should be cranial to the circumflex artery, which is outlined in red. In this clip, you can see the sonographer identify the humeral head. The probe is angled carefully to keep the shaft of the humerus in the long axis. You can then see the sonographer sliding the probe caudally. The axillary nerve and the circumflex artery are identified within the teres minor, just superficial to the shaft of the humerus. Using color Doppler here can also be helpful to identify the signal of the artery, to use this as a landmark. Once this anatomy is identified, you can set up to perform the block. Since the circumflex artery is caudal to the target nerve, the ideal approach is to insert the needle just cranial to the edge of the probe, which is seen here. The needle can then be followed using an in-plane approach, slowly advancing towards the axillary nerve. The needle tip is advanced toward the area just cranial and deep to the axillary nerve, shown here in this orange star. The shaft of the humerus here serves as a nice backstop. Injection should result in filling of anechoic anesthetic around the nerve, lifting the nerve up from the shaft of the humerus. 5 to 10 mLs of anesthetic is needed to achieve a good block. Thank you very much for your attention and for your interest in performing nerve block procedures that can greatly benefit our patients.